Good afternoon. My name is Nicole and I'm a physical therapist here at Mercy, and I'm going to talk with you today on fibromyalgia syndrome. By definition, fibromyalgia is a pain syndrome defined by long-term, chronic, and broad pain with fatigue, sleep interruptions, depression, and anxiety. A few other characteristics are multiple tender points which occur on both sides of your body, as well as above and below the waist. Now, many people ask why fibromyalgia is not considered a disease, but a syndrome. And according to the Arthritis Foundation, it's referred to as a syndrome because it is a set of signs and symptoms that occur together, but there is no known cause. It is not truly a form of arthritis because it does not cause any joint destruction, and it does not cause any true inflammation. It will not get worse, is never fatal, and is not progressive, but it has no cure. And there is no specific diagnostic test that will tell you if you have fibromyalgia. Some theories on the development of fibromyalgia is that it may be due to what's called a centroneuromodulatory dysregulation, which means basically the brain is interpreting signals incorrectly and therefore causing you pain and discomfort. Fibromyalgia is different from rheumatoid arthritis because it affects the lining of your joints, causes bone erosion and deformity, and often the small joints of your body first. So rheumatoid arthritis has the bone erosion and joint deformity, and fibromyalgia does not. Rheumatoid arthritis also affects your small joints, like your fingers, and fibromyalgia doesn't specify joints. Rheumatoid arthritis is also an autoimmune disorder, where your own body attacks itself, and that, again, they don't know why. But you may also have fevers and fatigue. Rheumatoid arthritis, you will have joint pain, joint swelling, joint warmness or redness. You may develop nodules, in particular on your hands, your elbows, your spine, and your heels. You will not develop this with fibromyalgia. Rheumatoid arthritis also has specific lab tests to include elevated sedimentation rate, rheumatoid factor, and anti-CCP antibodies. In fibromyalgia, unfortunately, there is no specific test that will tell you, yes, you have fibromyalgia. But with rheumatoid arthritis, there are 3 tests that will clarify your diagnosis. Fibromyalgia syndrome differs from another condition called polymyalgia rheumatica by the following. Polymyalgia rheumatica is an inflammatory disorder that causes muscle pain and stiffness. It rarely affects people younger than 50. So actually, the average age of onset for polymyalgia rheumatica is age 70. Polymyalgia rheumatica often begins with aches in your shoulders, your upper arms, your neck, your low back, your buttocks, and your thighs. With polymyalgia rheumatica, you can present with a low-grade fever, fatigue, malaise, weight loss, and depression. Again, with polymyalgia rheumatica, it is an inflammatory disorder. There is no known cause, but it may be parallel with a condition called giant cell arteritis. And there are tests to confirm the diagnosis of polymyalgia rheumatica to include your sedimentation rate, your C-reactive protein, ultrasounds, and possible biopsy if they suspect any concurrent giant cell arteritis. Many people ask, well, how does fibromyalgia develop and what causes it? It usually develops insidiously, which means there is no cause. They can't pinpoint an exact reason in any one person who develops fibromyalgia. It can run with other conditions to include rheumatoid arthritis, physical or emotional trauma, or sleep disorders. It may also be caused by skeletal muscle issues, abnormal pain signal transmission, or a virus. Fibromyalgia can affect both men and women, but women aged 20 to 50 are the most common. It affects approximately 2% of the population, and the risk does increase with age. They are also doing much research right now into a possible genetic link and familial tendency with fibromyalgia. They have found families where fibromyalgia runs generation to generation, and they are investigating different genetic possibilities to see if there is a hereditary component. There are several common signs for fibromyalgia, and they include body aches and headaches, and multiple tender areas, abnormal pain memory. And what that means is you may experience something, say, in your leg that wouldn't be painful to the average person, but is painful for you. And then your brain interprets any kind of sensation to that area as pain. Restless leg syndrome, allergic symptoms or chronic sinus issues, irritable bowel syndrome, jaw pain, issues or facial pain, so you may have pain or abnormal movement in your jaw, frequent eye movements and twitching in your eyes or eyelids, fatigue, heart palpitations, which means your heart beats funny or feels like it's beating too quickly or skipping a beat, numbness and tingling of your hands or feet, sleep issues, sensitivity to light, noise, smells, and temperatures, anxiety and depression, unspecified weakness or exercise intolerance. And what we mean by that is you just get very tired from very minimal activity, or you start to exercise and you can't finish, but there's no one reason. You just feel very weak and very tired. Ocular complaints, which means visual complaints, different things going on with your vision that don't seem quite right, and vestibular or inner ear symptoms. And this may be in the form of dizziness or balance disorders. So how is fibromyalgia diagnosed? There is no specific definitive test. The prior way to diagnose it was if you had widespread pain and a combination of pain and pressure when it's applied to tender point locations. You must have 11 of 18 points lasting greater than a 3-month duration. So there are specific points that they do on both sides of your body. If at least 11 out of 18 points are positive for 3 months, you may be diagnosed with fibromyalgia. Oftentimes, however, it is a diagnosis by exclusion. You may have extensive testing to rule out other diseases, such as Lyme disease, different forms of cancer, chronic fatigue, HIV, hypothyroidism, and sleep disorders. However, recently they have changed the criteria for diagnosing fibromyalgia, and they have eliminated the 11 out of 18 tender point criteria. This is very new, and so they're not sure how this will affect the diagnosis of fibromyalgia. What are the treatments for fibromyalgia? Diet and lifestyle changes. You want to eat well, and you want to follow the food pyramid, which has just changed, but you still want to follow the food pyramid. You could also seek a dietary consult if you have specific concerns or if you are afflicted with conditions such as irritable bowel syndrome in concurrence with the fibromyalgia. Eliminate caffeine. Caffeine is what we call a neurostimulant. So if your brain is already interpreting things incorrectly, the caffeine may actually enhance that, and that's not something that you want. And exercise. You can do education and counseling. Physical therapy is very beneficial for people with fibromyalgia. We can teach you how to do proper stretching, gentle strengthening, slow progression of aerobic exercises to include walking and swimming, aquatic therapy or therapy in the pool, and then exercise in the pool is often very beneficial. In the pool is a more weightless environment. Oftentimes, if you have joint pain, it's much more tolerable to exercise in a pool environment. Massage, and that varies person to person. Some people find massage to be extremely helpful. Other people find it to be uncomfortable. So you may want to trial it and see. Alternative methods, such as acupressure, acupuncture, relaxation techniques, and visual imagery. There are medications that can help. You must discuss any medication management with your physician, but there have been 3 new medications approved to treat fibromyalgia in the last 2 years. Lyrica, Cymbalta, and Savella. You may also benefit from a pain clinic referral. Again, you need a physician order for this, but then the pain clinic team can work with you and your physician to determine the best route to treat you for your pain and discomfort. There are a variety of ways to approach medication management with fibromyalgia. One is anticonvulsants. Now, normally these medications are used to treat seizures. However, one of these, Lyrica, has been approved for the treatment of fibromyalgia. Neurontin and Ativan are 2 other medications that are currently being studied in the treatment of fibromyalgia. Another category of medication is antidepressants. These are used for relieving pain and improving sleep, and Cymbalta is currently approved for the treatment of fibromyalgia, and it is also an antidepressant. Pain medications are often used to treat fibromyalgia. There are a variety of pain medications that can be utilized. Muscle relaxants often are used as well, especially if you have any trouble with muscle spasms or tightness in the muscle that prevents you from doing your everyday activities. There are several benefits of exercise with fibromyalgia. Exercise increases what we call the serotonin levels, which enhances your mood. So when you exercise, if you've ever heard of anyone say when they run, they get a runner's high, it's because when you run, you actually are working your body, releasing the serotonin, and when you're done, you feel really good. It's the same with any exercise. When you exercise, you will feel better. Exercise also increases blood flow, decreases stress, decreases stiffness, decreases muscle tightness, and improves your ability to sleep. Exercise will assist you with maintaining your independence with activities of daily living and keeps muscles strong and flexible. Muscles that are weak or tight will actually cause you more pain. My bibliography is online. If you have any questions, please feel free to contact us here at the clinic. Thank you.